And I want to start off with some fairly disappointing news, actually. The Chinese officials representing the Chinese government have said that the novel coronavirus can now be spread by aerosolization. That is, it can be spread through the air. This is what they are now saying. Now, we've known pretty well from the start of this epidemic that it could be spread by droplet infection. Droplet infection is when someone coughs or sneezes or even breathes out. And because the air we breathe out is moist, then the viral particles which are lining the surface of the respiratory tract in someone who is infected will be breathed out with the air that they are exhaling in the normal moisture in their breath. But aerosolization is different to that. With droplet infection, you probably need to be within about 2 meters of the person coughing or sneezing. It's a fairly localized effect, close contact. But with aerosolization, you could be a much greater distance away. So I don't think there's any way to wrap this up. It's not good news. It does mean that this is going to be oh so much harder to stop. So that's the first item that's sort of struck my mind today. Now, in the UK, there's now 8 cases. 4 new cases have been identified in Birmingham. And the World Health Organization, which I've wondered why they've been a little bit reticent so far, but they've said that this could be the spark that could start a fire. But they do stress at the moment it's only a spark. But it does show that this potential for spread is there, which makes this disease very hard to stop. I have been concerned about a pandemic for the last couple of weeks. And I think with today's news, that now looks more likely to occur. And my government, I'm not sure what this means, but they've said in the UK it's now novel coronavirus is now a serious and imminent threat to public health. Now, I think there was 2 reasons why they did this. One was there was someone who's in quarantine, I think in the Merseyside group, who wanted to abscond. So now they can legally force him to stay, or her, I'm not sure. So I think it gives the government more powers to enforce quarantine, which I'm more than happy with. If people won't stay in quarantine voluntarily, for the good of the community, it is reasonable to enforce that. So this serious and imminent threat to public health allows them to do that. But I think the other thing that's concerned them is this super spreader case. Now, we know that the R0 is the index of spread, the reproduction of the infection. And we believe that the R0 for novel coronavirus is around about 2.5, between 2 and 3, somewhere around about there. But the R0 is the average value. So for every person who's got the condition, on average, 2.5 new people will get it. That's what an R0 means. But super spreaders can spread it to many people. Now, super spreaders, it is a term that epidemiologists are using, although the biological underpinnings of this aren't entirely clear. But presumably it means they're shedding a lot of the virus. So their cells are producing a lot of the virus. The viruses have gone into the cells in their respiratory epithelium. The coronavirus has hijacked the cells in their respiratory epithelium, lining the lower parts of their lungs particularly. It's taken over the genetic material in those cells in the respiratory epithelium and forced it to make viral particles. The analogy I used to use with my students is a bit like walking into a biscuit factory where they're making digestive biscuits. Walking into the manager's office, taking a gun out, pointing it at his head and saying, "Unless you tell all your workers to stop making digestive biscuits and to start making chocolate biscuits, I'm going to blow your brains out." So he tells everyone to start making chocolate biscuits. It's kind of hijacking the control, if you like. And this virus gets in and hijacks the means of production. And the means of production is to make new proteins. And instead of making new proteins for the cells, it orders your own body cells to make new viral particles. It's a complete hijack situation like that. And these viral particles will be shed onto the respiratory lining, and then they can be breathed out and coughed up. And presumably these people that are super spreaders do that in great numbers, but without getting very sick themselves. And this is what seems to have happened in this case. So we know this is a middle-aged businessman from the UK. We know he flew to Singapore, and we believe he contracted the virus in Singapore. And then he flew to France, we believe, on the 24th of January. So that means he was infected on the flight from Singapore to France. Now, at that stage, it was presumably early in the infection, so you'd expect the viral numbers to be small. We think that in the early stage of the infection, people will shed less virus, but no one knows that for sure. So it's likely he wasn't shedding a lot of virus on the flight from Singapore to France, but he could well have been. And then in France, he shared a cabin in a ski lodge, and there he infected the other 4 people, I believe, that were staying in the cabin with him. I believe it was another 4 people. And he was still feeling okay at this stage. And then he flew after this. So he stayed in France on the 24th, infected these people in the cabin, unbeknown to them at the time. Then he flew from Geneva to Gatwick in the UK on the 28th of January. And he was asymptomatic on the flight. So he had no symptoms. As far as we know, he was not feeling ill on the flight. But I don't know how many people were on that flight, but clearly they are at risk because this guy is a super spreader. We know he'd already infected 4 other people in the ski cabin in France. So he could well have infected people on the flight as well, and they're currently being traced. It was only later when he got home to Brighton that he was diagnosed and people realised he was a super spreader. Now, so this chap's a super spreader. He didn't know he had it. So what we have to do is kind of assume that we're all super spreaders. And that means we all have to be meticulous about coughing and sneezing into tissues and then putting them away, catch it, bin it, kill it, coughs and sneezes, spread diseases, or meticulous about hand washing, keeping our own germs away from everyone else. Now, the other thing that caught my attention was the Yokohama boat that's in quarantine, the Diamond Princess. There's now 136 people on that have tested positive for the virus. There is the shipping company assure people there that they are not spreading the disease around the ship. So we have to take their word for that. But it is reported today that 136 people have reported positive. And something that really concerned me was the Japanese authorities said they couldn't screen everyone on board the ship. And there's 3,600 people on board the ship. So it appears in the nation of Japan, they don't have enough testing facility to test 3,600 people. Now, that is concerning because Japan is an advanced, technologically brilliant nation, of course. And if they can't screen 3,600 people, what chance have poorer countries got with more poorly developed health systems? So I want to look at some numbers. I'm going to try and look at some numbers. I'm just seeing if this is going to work. So I'm starting to use this Chinese site. Now, it is an official Chinese site. I've had so many emails saying, what can we trust about official Chinese sites? But here is the official Chinese site. Notice I didn't answer that question. Right. So, let me translate this for you. That was a joke. I do know what it is. So this is confirmed cases here. Johns Hopkins actually gets a lot of their data from this site, I believe. So confirmed cases there, 40,262. These are suspected cases here. And there are links to this website if you want to follow it on previous videos. Now, what's been very useful on this site here is these are the number of people that get severe illness. So these are people that are severely ill. These are people that have died, unfortunately, now over 900 on the official figures. and these are the ones that are recovered officially, 3,551. So this death rate is still working out at about 2.5%, I think, from official cases. But what I've calculated, what I didn't quite have the data for before, was the number of serious cases. Because we want to know, and this does now look like it's a pandemic, what I need to know as a local healthcare person is how many people are going to get very sick in my area. How many people are going to come into my A&E department who are very sick. That's what I want to know. So given that they're the current figures, we can sort of work this out a bit, I think, and work out what the probable complications might be. So what I've done here is, if my maths are wrong, I hope you will correct me. Do work it out for yourself. Take my word for nothing on these videos. So that's the number of people that are sick. That's the total number. Times 100 to get it to a percent. And what it's looking at, as we've looked at from previous peer-reviewed literature, from, I believe, the Lancet and the JAMA, we've looked at it in the past, 16-17% of people getting severe illness is about right. So of the people that have been confirmed, 16.61% are quite poorly. Now, it seems quite a large majority have a minor illness, which is just wonderful. And it also looks like children are often not severely affected, which is also wonderful. But it does leave 16% that can have severe disease. Quite how we define that, I'm not sure. We're going to think about that in a minute. But if we take into account the suspected cases, so that's the confirmed cases, they're the suspected cases, add those two together and it gives us that. And we know the number of severe cases, that's a fixed number. So if these suspected cases are actual cases, then that will give us a rate of only, I say only, it's still bad enough, 10.2% having severe disease. So what does this mean in practical terms? Well, it means if 10,000 people get the infection, looking at a best case scenario, then 1,000 are going to get severe disease. In the worst case scenario, it would be 16%, 16.1% are going to get severe disease. So 10,000 people in a population area of, I don't want to make up a figure, but let's say 10,000 people in a population area get the infection. 1,000 we can expect to be really quite poorly with that.